Having learners as part of our patient care teams effectively decreases our pharmacist to patient ratios. We're able to care for more patients and provide more in-depth care. We are able to increase the number of patients who have a pharmacist or a pharmacy learner perform their medication reconciliation upon admission, as well as their med teaching before they're discharged. So we really consider our learners as our pharmacist extenders, and they're crucial members of our patient care teams.
For me, what I really want to talk to you about today is how I really helped leverage these learners, whether it was through the pharmacy students or pharmacy residents, to help expand practice at our site. I have found in my 16 plus years of doing this that if you really empower your students, if you spend a few days at the beginning of a rotation on the front end, really putting in a good orientation and kind of setting that expectation and tone for what you expect them to do and how you expect them to perform, they are extenders of care. You can get more done in your day than you could otherwise do on your own. A few examples would be with the medical resident teams that I round with, being a larger presence early in the morning hours, working with the medical residents on overnight admissions, medication reconciliations. At our particular practice site, our pharmacy residents have started new services. They helped develop our new medication reconciliation process with our ABE students just because we had more power in numbers. They were able to provide and begin to start small services in the emergency department. We were able to do some work in a bariatric clinic that we couldn't have otherwise covered.
Because both students and residents are actively engaged in patient care, I'm able to provide more pharmacist services because I have learners. Medication lists are critically evaluated daily. We're available for patient education that I may not otherwise have time to provide. We're an integral part of the transitions of care process from our patients who are moving from the hospital to home, and we help with medication access, among other things that we're able to provide. On my service, we're also involved in formal medical resident and medical student education through delivering morning report presentations on medication-related topics to the entire inpatient teams each week, and that's absolutely something I wouldn't be able to do without my learners. On rotation, there are always at least one pharmacy resident and 1 to 2 pharmacy students, and this layered learning approach allows residents to have first-hand experience with precepting students, which will play a role in preparing them for precepting learners after graduation. As well, the structure of the rotation allows practice and autonomy with important skills for each level of learner. Not only do my learners benefit from the experiences on my rotations, but my patients absolutely do as well.
Really utilizing your learners, empowering them, helping them really contribute to patient care rather than just being there as an academic exercise really will allow you to really truly get the most benefit and value from them.